Hi, so a patient comes in, they have a headache. First, you want to assess them using the Olckert's method. So when was the onset of the pain? Where's the location of it? The duration, how long does it last? The characteristics of it. Is it pins and needles? Is it throbbing? Does anything you do alleviate the pain or agitate the pain? Is it radiating or is it referred? Treatment, have you done anything to treat the pain? And then severity, how severe is the pain on a scale of 0 to 10? Once you've done this, then you can go ahead and start with your head to toe. You want to start with neurological, and first thing you want to do is assess for consciousness. So are they awake? If they're awake, then you want to check, are they alert? So are they alert to the person, to their place, and to the time? Once you've done this, then you can go ahead and check pupillary responses. You want to take a pen light coming in from each side, and what you're checking for is that the pupils are equal and reactive. You can also use a peripheral test. So you want to ask them to follow your finger, and you're going to go in a complete square. They should be able to do this without moving their head. You want to check their extremities, their arms and their legs, and make sure that they're able to move them in a logical way, so not just spontaneous. You also want to check the strength, and this should all be bilateral for all parts of the body. You put your hand on top of theirs and then push down and ask them to push up. And you can do that for their hands and their feet, and you're just making sure the strength is equal both sides. Once you're done with that, you can go ahead and move on to the lungs. And what you want to do is you're going to listen for a full breath, and inhale and exhale on each location. And you want to move bilaterally side to side in order to compare the two. So you're going to start up here, moving over. You're going to move in a little bit more. And what you're listening for is wheezing, which could be indicative of asthma. You also want to listen for stridor, which could be an obstruction of you. And you also want to listen for crackles as well. That could be indicative of fluid. And a lot of times you're going to be able to hear that in the back of your lungs. And then once you get down to about here, you're going to go mid-axillary to listen to the sides. And then same thing for the back. You're going to start up top, and you're going to move your way down. Once you get about here, you're going to go again on the sides, listen to the sides of the lungs. Next, you want to move on to cardio. So for cardio, you are going to start at the aortic valve, which is just about here, and then the pulmonic, Erb's point, tricuspid, and then the mitral valve. And what you're listening for is S1 and S2. You also want to be aware that you could hear S3 and S4 as well. This is also the apex of the heart, so you can listen to the apical pulse here, and you could also listen to radial. And what you're looking for is rate and rhythm, and that should be about a 2+. And then the other pulses that you can listen to are femoral, popliteal, and dorsal pedal. Another thing you want to check is you could listen for bruits in the carotid artery. You just want to make sure that you're not hearing any swishing sounds. And then also you can check the jugular vein as well and make sure that that's not distended and like swollen and sticking out. For cardiovascular, you also want to check capillary refills and ensure that there's proper refilling. That should be 2 or less. And then you want to do that in your fingers and in your toes. And then you want to check your legs for edema. And if there's edema, pitting edema, you would just want to rate that 1, 2, 3, or 4, depending on the severity of that. So once you're done with the heart, you want to go to the abdomen. And you're going to start in the right lower quadrant and go in each 4 quadrants. And you want to listen for about a minute each. But you want to make sure that you're hearing bowel sounds. Anything more than 5 minutes without bowel sounds is an emergency. You want to palpate the stomach, just checking for any unusual masses or enlarged tissue. So you got the liver and the spleen. And then for tenderness. So rebound tenderness is a great way to figure out if you have any of those issues as well. You also want to ask them when their last bowel movement was. For GU, then you want to ask them their urination. You want to make sure that they're having adequate urination, because that could be a huge issue. You want to ask them the color, the clarity, and if there's any odor, which would be indicative of a infection or some sort of UTI. And then lastly, for patient teaching for cardiovascular health, you want to let the patient know that an adequate diet low in fat and exercise is great to help with the cardiovascular system.